We will next go to David Couch. After David Couch, we will have Stephen Oster. Thank you. Welcome.
Thank you. Vice Chairman Boos and members of the House Finance and Appropriations Committee, I thank you for the opportunity to testify before you today regarding House Bill 483. My name is David Couch, and I'm the Superintendent of the Perry and Hocking County Boards of Developmental Disabilities. I ask that you reference the testimony that's been provided to you that we submitted earlier, because I'm going to try to summarize my testimony in a few places, because last night when I went through it, it took a little over 7 minutes, and I wanted to get within that 5-minute time frame. And I believe with my two colleagues who are here, we can stay well within a 15-minute time frame. So I just request that you reference that as I move through this.
Very good.
County Boards of Developmental Disabilities have a long tradition of pursuing innovative partnerships to optimize their efficiency and enhance the quality of services they provide to people with disabilities. For more than 25 years, County Boards of DD have used regional councils of government that allow our boards to realize economies of scale in various areas, including the administration of Medicaid waivers, investigation of major unusual incidents, and the implementation of quality assurance reviews. Many county boards of DD have also adopted shared services arrangements in which staff members perform functions for more than one board at a time across county lines. These arrangements save county boards a significant amount of money because one employee can divide his or her time and expertise between multiple agencies. County boards of DD also partner with local governmental agencies and community organizations to create innovative programs. In one of my counties, for example, the Adult Services Program operated by the Perry County Board of DD has collaborated with Ohio University to develop greenhouses that are heated by food waste from local schools. All the partnerships I mentioned were the result of creative thinking by county boards of DD and not the result of any formal requirements by the Ohio Revised Code. While the sharing of many county board personnel has made sense in some counties, local needs and circumstances can make similar arrangements impractical for other counties. For this reason, we believe removing barriers to shared services that currently exist in the state law would greatly assist county boards that are looking to create more shared services arrangements. County boards of DD have proven themselves as leaders in this arena thanks to the flexibility allotted to them in current law. By offering boards more flexibility, we believe county boards will be able to greatly expand their shared services leadership in coming years. We are requesting that the Ohio General Assembly include 3 amendments to House Bill 483 to remove statutory barriers to the expansion of shared services in the following areas. Number 1, shared employees. Current law gives county boards of DD the authority to enter into an arrangement to share the services of a superintendent, a business manager, and Medicaid services manager. However, there is no language explicitly granting this authority to county boards for certain management employees and other employees. Because of this lack of explicit language in the revised code, some county prosecutors have questioned the authority of a county board to share the services of various employees. To provide clarity and encourage more shared service arrangements across the state, we are asking members of the General Assembly to amend House Bill 483 with language in the revised code section 5126.02, which states that a county board may, at any time, enter into an agreement with one or more county boards to share the services of an employee. Secondly, employment restrictions. Current law unnecessarily impedes collaboration between county boards of DD by restricting certain employees from serving on the governing boards of local nonprofit entities. We believe that the language in this section should be repealed because Ohio's current ethics statutes sufficiently safeguard against conflicts of interest or otherwise undesirable outcomes. We respectfully request the committee amend House Bill 483 to repeal 5126.0221. Thirdly, contract restrictions with community agencies. Section 5126.037 of the revised code has prevented county boards of DD from pursuing shared services partnerships with local non-governmental agencies like community action agencies. Once again, our state's existing ethics laws prohibit conflicts of interest in Ohio. Public officials can simply abstain from voting on an issue that directly involves the use of public funds or involves an issue that the public official has responsibility for or influence over. We respectfully request the committee amend House Bill 483 to repeal 5126.037. In 2010, the Ohio Supreme Court ruled in re Guardianship of Spangler that county boards of DD do not have the expressed or implied authority to file a motion to remove the guardian who has been found incompetent by a probate court. In order to address the implications of the ruling in the Spangler case, as well as adequately protect the health and safety of the people served by the county boards of DD, the Ohio Association of County Boards of DD has worked closely with the Ohio Association of Probate Court Judges to draft an amendment to House Bill 483 that would give a probate court the ability to permit a county board of DD to prepare evidence, present witnesses, cross-examine witnesses, submit memoranda, and carry out such other actions as the court may designate if the court finds that certain conditions are met. This condition would be present when there is probable cause that a county board eligible person's health and safety is at risk, and that participation of a county board of DD in the proceeding will permit a full and fair review of the facts pertinent to the hearing. Representatives from both the probate court judges and county boards of DD have discussed this issue at length and have reached an acceptable compromise that allows the court to manage its authority while offering county boards of DD the opportunity to fulfill their obligation to protect the interests of the people we serve. We appreciate the committee members' consideration of this amendment to further protect Ohioans with developmental disabilities whose health and safety are put at risk, and respectfully request that the agreed-upon language be included in the committee's amended draft. Language in the Ohio Revised Code Section 5126.022 requires a board of county commissioners to select two people who are immediate family members of a person eligible for services provided by the county board to serve as board members on a county board of DD. We believe that there are instances where people eligible to receive services from a county board of DD have the same valuable insight into the DD system that an immediate family member has when considering issues before the board. For this reason, we respectfully request that this section be amended in order to give commissioners the ability to select individuals eligible to receive services from the county board of DD to serve as members of a county board of DD in order to meet the family member requirement. Ohio's county boards of DD look forward to continuing our work with the Ohio General Assembly and Governor Kasich to continue enhancing the lives of people with developmental disabilities in our state. Thank you again for this opportunity to testify before you. I am happy to answer any questions you may have.
Thank you for your testimony. Are there any questions for Mr. Couch?
Thank you.
Seeing none, thank you. Next, we will have Steve Oster, and following Steve, we will have Michael Kirkman, I just see is written. I guess Casey Claxton will then be next. Thank you.
Vice President Boos and members of the House of Finance and Appropriation Committee, thank you for the opportunity to testify today. My name is Steve Oster, and I'm the superintendent for both Knox County Board of Developmental Disabilities and also Coshocton County Board of Developmental Disabilities. I'm also a member of the Ohio Association of County Boards of DD and president of the Superintendent Association of County Boards of Developmental Disabilities. I'm pleased to share with you an attachment to my testimony to report how shared services were compiled, and I'll show you how each county in Ohio are sharing services, and that's very important. In January of this year, county board superintendents identified how many boards currently share one or more major functional service areas, either with other county boards of developmental disabilities or council or governments. For a listing of major functions covered by the survey, please reference the attached document. The survey results confirmed what many of us already knew. County boards of DD are highly effective in pursuing shared service arrangements in the status quo. With all the county boards responding, superintendents found out that 93% of county boards share at least one major function overall. Nearly half, 49% of county boards firmly share at least 5 major functions, and top management positions were among the most common positions shared, with 17 counties sharing the services of 8 superintendents. So we believe DD is kind of leading the way with shared services across Ohio. In the attachment, you will find 3 heat map indexes showing the saturation rate and shared services arrangements from Ohio. Further study is planned to identify additional shared services that are not captured in our initial survey. These measures include efforts to partner with other local entities, such as local transportation authorities, job and family services, human service agencies, and local school districts. and we believe they're all valuable partners in the system of developmental disabilities. County Board's ability to experiment and pursue efficiencies over the past 4 decades has allowed us to remain flexible and responsive to the needs of local communities at a time when state resources have dramatically fallen. It's a necessary skill to have when planning for lifetime services and supports for people with developmental disabilities. And remember, as counties, we serve people from birth until the end of their lifetimes. In my 2 counties, Knox and Coshocton, we have realized significant savings by sharing positions. Sharing these positions in both counties may not always be a good fit, but for Knox and Coshocton, it did make sense. In my 2 counties, we share several staff members, and it allows us to retain a high quality level of staff. This is because we can offer them a little more compensation while cutting down each board's cost in that area. Shared services have resulted in a savings of approximately 5% of each county board of DD that I serve, which is a total dollar amount of more than $400,000 per year that is saved by the county boards. As administrator, I know these savings will go towards serving people with developmental disabilities, and that's what we're really here for. Sharing of services has also resulted in more collaboration among staff, more trainings, we're able to apply for more grants and get better services. Ohio County Boards of DD are supportive of the efforts of the Ohio General Assembly and Governor Kasich to expand the use of shared services. We believe that by working together to remove barriers to shared services, county boards can continue to expand and accelerate our progress in this area. Thank you again for this opportunity to testify, and I'm happy to answer any questions.
Thank you very much for your testimony. Are there any questions? Thank you. I lost my place here for a minute. Casey Claxon, please. Coshocton Board. Thank you.
Vice Chair Booz, members of the House Finance and Appropriations Committee, thank you for the opportunity to testify to you regarding House Bill 483. My name is Casey Claxon. I'm the president of the Coshocton County Board of Developmental Disabilities. My interest in the DD system and my eventual appointment to serve as the Coshocton County Board of DD grew out of a unique partnership in our community that I helped create while serving as the executive director of Kids America, a nonprofit indoor athletic complex founded in Coshocton to promote health and wellness among children and adults in our community. Part of my job duties included working with the Coshocton County Board of DD to integrate fitness and wellness activities into the lives of the people that our board serves. I also worked with the local Kiwanis Club to incorporate the Coshocton County Board's basketball team events in our facility and to help reduce admission fees and membership rates for people with developmental disabilities to allow them a greater access into our facility. Doing so allowed people with DD and typical community members to have more opportunities to interact. Through my work with this unique community partnership, I became interested in serving on the Coshocton County Board of DD. The Coshocton County Board of DD is one of 17 county boards of DD in Ohio that currently shares services of a superintendent. In addition to sharing that position, we also share several other staff members with the Coshocton County Board of DD and participate in numerous collaborative arrangements with various community agencies in both Coshocton and in Knox counties. As the president of the Coshocton County Board, I believe that our shared services arrangements have been 100% positive for our community and our boards. And because each community is different, our boards are able to engage in careful planning and collaboration in order to ensure that we would be able to reinforce existing areas of need in our community. This collaboration process has also helped us learn from the strengths and partnership in county programs, as well as help each other in our community and in our county to improve outcomes for the people that we serve. The sharing of payroll costs between the 2 county boards has allowed us to hire and maintain a higher quality staff. This has been essential for us in a small county with stretched resources, and it would not have been possible without the cooperation with our friends in Knox County. Our participation and partnership with them has encouraged us to think more globally. Maintaining this broad perspective has become part of the culture in our organization and has become integrated into the self-assessment and strategic planning process in which we engage during our 2 joint board meetings that Knox and Coshocton County boards hold annually. In conclusion, I believe that working with the partnership with the Ohio General Assembly and the Kasich administration to remove statutory barriers to shared services, we will be helping Ohio's County Board of DDs to expand shared services even further. And I'm proud of the tradition of innovation and collaboration that our County Board of DD has established thus far, and we look forward to continuing the tradition into the future. Thank you again for the opportunity to testify for you today, and I'd be happy to answer any questions at this time.
Thank you very much for your testimony, and thank you for serving on the board. My mother, many moons ago, served on our local DD board, so I appreciate what you do, and I'm sure she wished she had some of these shared services that you have today. Are there any other questions? Representative Driehaus.
Thank you,
Vice Chair.
Mr. Chair. Thanks for being here. I just want to comment, you didn't highlight it, and I want to. There are 3 maps associated with your testimony, and I think the visual helps us better understand how much you are doing by way of shared services. In some cases, 5 major functions, 8 major functions. So I just want to make sure that committee notes these maps. I think they're very helpful, and thank you for those.
Thank you, Vice Chair. Thank you, Representative.